Welcome, and thank you for joining us today for a training on the New York State Workers' Compensation Board's Prescription Drug Formulary. This presentation will provide an overview of the Board's Prescription Drug Formulary and Prescription Prior Authorization process. We'll start with a look at the medical portal, including how to access it and what it will contain. We'll also look at the different drug lists that comprise the drug formulary and discuss special considerations that pertain to drugs on the formulary. And we'll discuss when prior authorization is required for non-formulary drugs and the process for submitting that prior authorization. Let's start with the medical portal. Accessing the New York State Workers' Compensation Prescription Drug Formulary and Prior Authorization process is done via the newly developed medical portal. The medical portal is the gateway to a number of functions that stakeholders need to do business with the board and with the workers' compensation system as a whole. It should be noted that functionality available within the medical portal varies by user type. The functionality is tailored to the needs of the specific stakeholder accessing the portal. The medical portal will be accessed either by visiting the medical portal page on the board's website or by using the Login to Access drop-down on the board's homepage and selecting Medical Portal. The user will then be brought to the NY.gov login screen. Users must have an NY.gov ID to access the medical portal. After logging in using an NY.gov ID, users will be taken to the Secure Medical Portal landing page. There's a video on the board's website that'll step you through the sign-in process to access the medical portal. Visit wcb.ny.gov, search Medical Portal, and click on the Medical Portal Overview link. The landing page is comprised of 3 sections that contain different categories of information. They include medical providers, treatment, and billing. The medical providers section is the starting point for provider-specific information. Training on a number of workers' compensation-related topics is available, and it's required training for new providers applying to become board-authorized. It's also available as a refresher for providers who are already board-authorized. Also found in this section, providers' application to become board-authorized and the ability to update provider registration information. You'll also find additional links on the new provider legislation and information about independent medical examinations and impartial specialists. The treatment section provides direct access to information and functionality that providers will be using most frequently when treating injured workers. Included are adopted New York State Workers' Compensation Board medical treatment guidelines arranged by specific body part. A new medical treatment guidelines lookup tool. This will allow providers to enter a medical condition and desired treatment to find out if the treatment is recommended, not recommended, or conditionally recommended. An overview of the drug formulary. A drug formulary lookup tool allowing the provider quick access to see what drugs are on the formulary. The prior authorization request form, and links to information about the C4 and MG2 prior approval process. There is also a link to the DOH iStop prescription monitoring program available in this section. It should be noted that some of the functionality is currently under development, as noted by the wrench icon. The billing section provides access to the New York State Workers' Compensation fee schedules and information about what providers can do when a bill isn't paid by the workers' compensation payer. Next, we'll look at the drug formulary. Legislation was signed in April 2017 that required the New York State Workers' Compensation Board to establish a comprehensive prescription drug formulary by December 31, 2017. On December 28, 2017, the board announced the creation and release of the proposed New York State Workers' Compensation Drug Formulary and sought public comments. For reference, see subject number 046-1012 on the board's website. On October 17, 2018, the board revised the proposed formulary in subject number 046-1112 in response to public comment. On January 23, 2019, the board released subject number 046-1133, announcing a revised version incorporating additional public comments. The adopted medical treatment guidelines formed the basis of the drug formulary. Medications were added to the formulary based on their effectiveness and appropriateness for treatment of illnesses and injuries covered by the workers' compensation law. It should be noted that the formulary does not apply to drugs administered in a hospital or medical provider's office, but does apply to physician-dispensed medications. The formulary was adopted by regulation on May 21, 2019, and became effective June 5, 2019. This means that as of December 5, 2019, all new prescriptions must comply with the formulary, and by June 5, 2020, all refills must comply with the formulary. A new prescription is a prescription for a drug that the patient is not currently taking. This could be a different medication or same medication at different dosage. A refill or renewal is a subsequent fill of a prescription for the same medication when the number of refills is explicitly included in the original prescription. Additionally, no later than December 5, 2019, payers are required to notify providers of non-formulary drugs their workers' comp patients are currently taking, to notify patients of non-formulary drugs they are taking, and the need to discuss treatment options with their providers. The formulary consists of 3 drug lists: Phase A drugs, Phase B drugs, and perioperative drugs. A specific framework has been established for the prescribing of drugs within each of these 3 phases. Drugs on the Phase A list may be prescribed and dispensed within the first 30 days following an accident or injury, or until the payer accepts the claim or the board establishes a claim, whichever comes first. Drugs on the Phase A list can be prescribed for up to a 30-day supply, unless a special consideration is identified. Drugs on the Phase B list may be prescribed or dispensed after 30 days following an accident or injury, or less than 30 days after the injury if the payer has accepted the claim or the board established the claim. Drugs on the Phase B drug list may be prescribed for up to a 90-day supply unless a special consideration is identified. Also, it should be noted that the Phase B list is used when a body part or illness has been accepted or established. This may actually occur within the first 30 days following the accident or injury. At this point, the Phase B list should be used. Some Phase B drugs are designated as second-line drugs. This means they may be prescribed and dispensed after an unsuccessful trial of a first-line drug, prescribed in accordance with the Phase B list and the adopted medical treatment guidelines, as applicable. The perioperative drug list contains drugs approved during the perioperative period. The perioperative period is defined as 4 days before through 4 days following a surgery. As previously described, some Phase B drugs are designated as second line, meaning they can only be prescribed and dispensed following an unsuccessful trial of a first-line drug, prescribed in accordance with the applicable medical treatment guidelines. Some drugs on the formulary carry a special consideration. There are 4 different types of special considerations. Special consideration number 1 indicates that the drug can be prescribed one time only without a prior authorization and for a maximum of 7 days. An example of this is a narcotic prescribed for acute pain following an injury. Special consideration 2 indicates that the drug can be prescribed and dispensed for the prescribed course of therapy. Antibiotics are an example of special consideration number 2. Only the short-acting formulation of drugs designated with Special Consideration 3 can be dispensed. Opioids and skeletal muscle relaxants are examples. Special Consideration number 4, as clinically indicated for causally related injuries or conditions utilizing accepted standards of medical care, has recently been added to the formulary to address a number of questions that have been raised recently. Drugs in this category are available for treatment when there is no adopted MTG for the established or accepted body part or condition, and/or for a condition directly associated with an established or accepted body part, but not specifically addressed in the MTG. An example here would be the treatment of a post-operative infection following a knee replacement. The formulary is arranged by therapeutic category. It is then arranged by the generic name of the formulary drug. Relevant special considerations and the phase of the formulary for which the drug is designated are also listed. Either Phase A, Phase B, or perioperative. Medical treatment guidelines are listed and carry an indication if the drug is available, either as primary or secondary, within that medical treatment guideline. If the drug is not listed under the medical treatment guideline for which the patient has been established, and the drug does not have special consideration number 4 associated, a prior authorization request would be required before the drug can be prescribed and dispensed. An example here is naproxen. It's on the Phase A list and can be prescribed for any injury or illness during the first 30 days or until the case has been established by the board or accepted by the payer, whichever comes first. At that point, either after 30 days or acceptance by the payer or established by the board, it falls into the Phase B category. As a drug in the Phase B category, it can be prescribed if the injured worker falls under one of the medical treatment guidelines where there is a yes, for example, elbow. If the injured worker falls under one of the other medical treatment guidelines, for example, eye, an approved prior authorization would be required before the drug can be prescribed and dispensed. Functionality will also be available that will allow users to look for a specific drug on the formulary. After finding and selecting the desired drug, formulary users will be presented with full formulary information associated with that individual drug. Lookup by therapeutic category will also be available by accessing the drop-down menu. This will provide users the ability to view a list of formulary medications within the selected therapeutic category. After selecting a therapeutic category, full formulary information for all drugs in that category will be displayed. It should be noted that some over-the-counter drugs are also included in the formulary. When written as a prescription, covered over-the-counter drugs will be processed by the pharmacy and paid for by the payer. Now let's look at prior authorizations. There may be occasions when the prescriber needs to use a drug not listed on the formulary. In these instances, a non-formulary prior authorization request must be submitted and approved before the drug can be prescribed and dispensed. Additionally, an approved prior authorization request must be obtained for a brand-name drug when a generic version is on the formulary and for combination products unless the combination is specifically listed on the formulary. An approved prior authorization is also needed for a brand-name drug when a generic version of the same active ingredient is commercially available and on the formulary in a different strength. An example here is a product that is on the formulary and generically available in 5 milligrams and 10 milligrams, and there is a 7.5 milligram version that's only available as a brand-name drug. The 7.5 milligram version would be considered non-formulary, and could therefore only be prescribed and dispensed subsequent to an approved prior authorization request. Also, an approved prior authorization request is required for any compounded drug. To initiate a prior authorization request, the prescriber would go to the medical portal and select Drug Formulary Prior Authorization under the Treatment section. The user is then brought to their dashboard. Users can see the status of all their prior authorization requests, and they can make a new request there. Upon initiating a new prior authorization request, the prescriber will be asked to perform a case search for the patient. To perform a case search, the provider must enter the Workers' Compensation Board case number or the payer's claim number and at least 2 of the following: the date of the injury, the last 4 digits of the injured worker's Social Security number, the injured worker's date of birth, the injured worker's last name. Details of the searched case are then displayed. If the case has been established, the body part for which it has been established will be displayed. If the case has not been established, information about the injury will be shown in the details, including the nature of the injury, the part of the body, the cause of the injury, and an injury description. After a successful case search, users will select Proceed with Info to continue their prior authorization request. If a case cannot be found, it will show as no results found. The user can either return to the search and look for the case, or select Start Blank Request, and will be prompted to enter information about the injured worker. If the prescriber found a case, then information about the case and about the injured worker, the employer, the payer, and the provider will automatically populate the prior authorization request form. This includes the provider's email address. This email address will be used to notify the provider when a status of a submitted request changes. This can be changed for each individual prior authorization if the prescriber wishes to do so. But remember, all prior authorization responses must be done via the provider's dashboard. The prescriber then needs to provide clinical documentation justifying the need for the non-formulary drug. This can be done in either the form of free text or via attachments. The prescriber also needs to indicate if the drug being requested is an opioid, skeletal muscle relaxant, or a benzodiazepine. Information about the requested medication is then entered. Upon selecting the Submit button, the form is automatically routed to the appropriate Level 1 reviewer. The Level 1 reviewer then has 4 days to respond to the prescriber's request. If they deny or partially approve the request, a response specifically addressing the prescriber's justification for the non-formulary request should be included. If a Level 1 response is not received within 4 days of the submitted request, an order of the chair may be issued authorizing the request and requiring payment. The Level 1 response is automatically sent to the prescriber. Additionally, copies of all prior authorization transactions are filed in the injured worker's case folder in eCase. If the request is approved by the Level 1 reviewer, the prescriber will write the prescription. If the request is denied, they may either write for a formulary drug or they may request a Level 2 review. A Level 2 review request must be made within 10 days of the prescriber receiving the Level 1 denial or partial approval. In the Level 2 review request, the prescriber should specifically address the rationale the Level 1 reviewer provided for denying or partially approving the request. The Level 2 reviewer, the payer's medical director, has 4 days to approve, deny, or partially approve the Level 2 request. The Level 2 reviewer should specifically address the prescriber's response to the Level 1 denial. Again, the Level 2 reviewer's response will automatically be routed to the prescriber. As with Level 1, if the Level 2 review is not completed within 4 days, an order of the chair may be issued. Once again, if the Level 2 request was approved, the prescriber would write the prescription, or if denied, may opt to write for a formulary agent. If the prescriber wishes to appeal the Level 2 denial, within 10 days they should respond to the denial rationale from the Level 2 reviewer and submit a Level 3 review by the Workers' Compensation Board's Medical Director's Office, or MDO. The decision of the MDO is final and can only be appealed by the injured worker. The prescriber would then write a prescription for the requested drug if the Level 3 request was approved, or for a formulary agent if denied. To access the provider dashboard, select the Drug Formulary Prior Authorization link under the Treatment section of the Medical Portal landing page. The dashboard contains real-time information on the status of all submitted requests and is the mechanism by which all requests are communicated and responded to. This is a sample of the provider dashboard. The view contains data elements specific to the work the prescriber will need to track and respond to a prior authorization request they have submitted. The data elements include the name of the provider who owns the dashboard, the ability to go back to the medical portal landing page, and New Request. This is the starting point to submit a new request. For each request, the provider will then see the ability to view the request by clicking on the link provided, the current level of the request, and we'll discuss levels in just a moment, the current status of the request, we'll discuss that too, the date by which the next action is due. For example, if a request is Level 1 request and a status of submitted, the action date would be the date by which the Level 1 review must be completed. claimant name, claimant date of birth, medication requested, and the date and time of the status. Each column of the dashboard can be sorted. It's also possible to filter based on the contents of each of the columns. Finally, the provider can do a search of all records by entering a term they're searching for. View Request provides a link that, when clicked on, will open the prior authorization request form and show all information submitted up to that point. The level corresponds with the level of either the request or the review. For each level, 1, 2, and 3, there may be a request status and a review status. The different statuses include submitted. A request has been submitted by the provider and will remain in this status until an action is taken or the 4-day period has lapsed. Denied. The request has been denied. Granted. The request has been granted. Granted in part. The drug has been approved, but for a limited length of time, quantity, or number of refills. Approved OOC. The reviewer has not responded in the allocated time frame, and the request is deemed approved by an order of the chair. Granted final. The provider's time frame to respond to the Level 1 or Level 2 review has lapsed, or the MDO has made a final decision. Granted in part final. The provider's time frame to respond to the Level 1 or Level 2 review has lapsed, or the MDO has made a decision. Denied final. The provider's time frame to respond to a Level 1 or Level 2 review has lapsed, or the MDO has made a final decision. The provider will then see due date, the date by which the next action on the request is due, claimant name, claimant date of birth, medication requested, and current status date and time. This concludes today's walkthrough. For more information, visit wcb.ny.gov/content/ebiz/drug formulary. You can email general formulary questions to wcb-formulary-questions@wcb.ny.gov. Technical support questions can be sent to wcb-customer-support@wcb.ny.gov. You can also subscribe to receive updates from the board. Visit wcb.ny.gov, scroll to the bottom of the page, and select Get WCB Notifications. Thank you for joining us today.